Well, good morning and welcome to another edition of Expert Alert here on WLOX. This is where we have experts from different parts of the coast come in and talk about their expertise, of course, and their the things that they do, services they provide. And joining us this morning again from Integrated Medical, Sunny Elmer, who is the office manager and a registered nurse. How are you?
I'm good. How are you?
I'm doing fine,
Good.
doing fine. And we're going to talk about something this morning that might seem a little bit sensitive, but it is actually a problem that millions of men and women around the world have. Yeah, and that is we're talking about subject sexual health this morning. So and this is something. I mean, I know that y'all do general practice things. You know,
Yes.
You do shots and you know, checkups and all that stuff. So tell us about the sexual health area that y'all cover.
Sure. It is one of those touchy subjects. Nobody wants to come in the office and say they have any issues in the bedroom. But those problems are, I mean, issues in relationships when that starts to happen. So we're there for you to come in and talk to. If you have any problems with erectile dysfunction or low libido, or in women sometimes our libido's there and we just like a man, sometimes we feel like we can't perform. So we have this machine called a Zimmer. It's a shock wave, but it's an actually acoustic wave therapy. It helps regenerate the tissue in those targeted areas. So it's really good to bring the circulation back, which helps increase and improve your erection along with orgasms in women. The sensitivity levels come back. We want to take you from 50 to 15, which is quite possible, very possible.
And I've got to say, Sunny invited me to come in and try it out and see how it did, and you know, I could tell a difference.
Yes.
I could definitely tell a difference.
After a few treatments, that's the difference in stimulation is there for sure. We have a lot of really good results from people. We also want to kind of put it out there too. There is a thing in men called Peyronie's disease, which sometimes goes unrecognized by physicians. Just it's something that's not talked about a lot in general in sexual health. It is a curvature of the penis, and sometimes if the curvature is not there, there might be some scar tissue. So if there's ever any tenderness upon erection that's really not normal, I would recommend making an appointment. Even if you just want to talk about it with us, we can check and see if you have that. So the shockwave therapy, what it does is it brings those acoustic waves to the actual, it's like a fibrous tissue buildup in the penile area, and we can break that fibrous tissue down, which will straighten out that curvature, and it'll promote a healing, and you'll start to not have tenderness upon erections, and you'll be able to perform like normal.
Can that get worse? Peyronie's disease, can that get worse as time goes by?
It absolutely
can. To the point
can.
where it's very painful?
Yes. Some younger men may notice a curvature without any pain, but as you age, it does start, that fibrous tissue can increase in size. It can get worse as you roll over on your stomach, because men and women, men get erect in the nighttime and you don't even notice sometimes. So even just a simple rolling over on your stomach can cause a little break in that connective tissue, and people don't even realize it.
And what is it, as far as for women, how does the Z-Wave work?
That more brings back the sensitivity to the areas. Again, we're increasing that blood flow, which blood flow is needed all over. So it increases the sensitivity and it increases the orgasms in women. So if sometimes you feel like you just can't get there, when you come in after a couple of treatments, you're going to get there.
You're going to get there. Like I said, it was a little sensitive subject this morning, but it's necessary, because these are some issues that a lot of people deal with on a private level.
Yes.
And keep to themselves and just think there's nothing I can do, and there actually is. There actually is some things you can do. Talk about the Wharton's jelly.
Okay. So that is a real connective tissue. So we're looking at because it's a real connective tissue, you can inject it into the focus area that you might have that Peyronie's disease in. And what that's doing is that's bringing back some collagen there. So it's helping heal. Not only are we breaking the fibrous tissue up with the shockwave, but now when you come in with that injection, you're promoting the extra healing from internally in the inside and bringing those connective tissues back that were damaged.
And that's used primarily for Peyronie's disease.
Yes. We can also, what we're talking about doing as well is for our knees. You run into having osteoarthritis, so that connective tissue, you have a lot of connective tissue in your knees as well. So that Wharton's jelly can also promote healing and regeneration in those knees to help with osteoarthritis.
Okay. How much of a role does testosterone play in having ED?
Believe it or not, it doesn't play a role at all. So a lot of patients tend to, when we talk to them, they want to kind of opt out of dealing with the erectile dysfunction because supposedly somebody told them they had an issue with testosterone. Well, your testosterone only plays a role in your libido. So if your libido's there and you're all in, but he's not, I mean, it's just going to make you more frustrated, your spouse more frustrated, because women tend to start thinking that we're the problem. So if your testosterone levels are low and you also suffer with erectile dysfunction, don't think that that's going to fix the actual erectile dysfunction. We actually can treat for both. We really recommend that you kind of tackling it at one time. That way you don't fix one thing and not the other, and you're still kind of lingering, and that frustration is still there.
Yeah, women have testosterone too.
We do, and that also is a libido drive for us. I personally, I've had the pellet insertions at our office. I get BioT, and I would say in about 3 weeks, my fiance was like, "You must like me again," and I'm like,
Talk about the BioT, if you would, a little bit.
Sure. So that helps treat. Of course,
this is for
the
women.
testosterone for men and women.
Oh, men too.
Men
okay.
will get BioT as well, testosterone. So any injections, testosterone shots, or if you're taking synthetic medications in general, such as your estradiol or like an oral testosterone or anything, that's all synthetic medications that have to be metabolized in your stomach, your liver, and you kind of want to stay away from all that, because with the actual hormone insertion, it doesn't have to go through any metabolization process. So our hormones run through our bloodstream. It doesn't have to metabolize first naturally.
Right.
So with the pellet insertion, when we do the insert, it goes into the soft tissue, and it just releases straight into your bloodstream.
Okay.
It bypasses all of.
Of course,
the
the patient has to come in and
Yes.
get blood work and everything, because you got to have the right dose.
Right. So they see our nurse
You don't
practitioner.
just say, okay, I'll take
No,
that. Pop it in there.
They see our nurse practitioner. We get some labs drawn. We do all the testosterone labs, estrogen labs, just to make sure. Our nurse practitioner comes in and she'll let us know what the dosage is for that particular person. Our lab levels can be exactly the same, but we also base it on your questionnaire and how you feel, because your level may be good for you but not good for me.
Right.
So she doesn't just base it off of your labs, but also kind of that discussion that's had with her in the office as well.
Is the shockwave treatment the only treatment that you use for the ED problem?
Yes, as of right now it is, again with the Wharton's jelly with Peyronie's. We also offer the PRP, which is platelet-rich plasma, for our men as well, and women in the G-spot. Again, that's just going to increase everything. That just increases healing, increases any plasma. I mean, you're looking at taking plasma from your own
Body.
generated blood, and we're re-injecting it into the areas that need healing.
Okay.
So it's like a target. We're targeting those sites.
Okay. And if anyone wants information on this, wants to make an appointment,
Yes.
you can call their office, and the number's on your screen. They're located on East Pass Road in Gulfport. Still working on moving to a new location.
We're working on that. A
New location over in Biloxi, so that'll be coming soon. Okay.
If anybody feels uncomfortable, I know ED or even in general, sexual health is hard to talk about. You don't have to call and let our front desk girls know what you're calling about. I'm always available, so you can ask for myself, Sunny, or Amelia is my partner that does with the sexual health as well. So just ask for the one of us. Nobody's going to ask you why, and they'll just hand the phone over or leave us a message if we're not available, if you feel uncomfortable wanting to schedule that appointment with the front desk people.
Great. Thank you, Sunny.
Yeah.
Appreciate you coming in, and I guess we'll see you next month again
Yes,
for
sir.
another edition of Expert Alert. Integrated Medical, again, they're located at 2160 East Pass Road in Gulfport. Your phone number is on your screen there. If you want to set up an appointment for a very discreet meeting, be sure and give them a call. Thank you very much. We'll see you again later.
If you have a question for any of our experts, go to WLOX.com and click on Expert Alert. For a list of any of our upcoming experts, go to WLOX.com and click on Expert Alert.